I need you to stop whatever you are doing right now, because what I am about to share with you could genuinely save your life tonight. I am Dr. David Anderson, and after 22 years of treating stroke and heart failure patients, I have seen something that breaks my heart every single time. Men and women over 50 who had no warning, no chest pain, no alarm bell, and yet woke up unable to speak, unable to move, or in some cases, never woke up at all. And the one thing many of them had in common: the exact position they slept in every single night. Before we go any further, I want to ask you something. Where are you watching from right now? Are you in the USA, Canada, UK, Japan, Australia, Germany, or somewhere else? And how old are you? Drop it in the comments. I read every single one personally, and your answer genuinely helps me tailor this content for you. Now I want you to understand something deeply. Sleep is not just rest. Sleep is when your cardiovascular system either repairs itself or quietly begins to fail. A landmark 2019 study published in the journal Stroke followed over 4,000 adults above the age of 50 and found that poor sleep positioning was directly associated with a 46% higher risk of nocturnal ischemic stroke. That number terrified me when I first read it, because nobody warned these people. Nobody sat them down and explained that the way they positioned their body in the dark was silently influencing blood pressure, brain circulation, lymphatic drainage, and spinal cord health all at once. Tonight, I am going to be that person for you, the one nobody was for them. Let us start with the 3 sleeping positions that are genuinely protecting your brain and heart right now. The first is left side sleeping, and the evidence behind this one is extraordinary. A 2022 study from the Journal of the American College of Cardiology confirmed that left side sleeping reduces cardiac workload by improving venous return, takes pressure off the inferior vena cava, and significantly reduces acid reflux episodes that often trigger nocturnal arrhythmias in seniors. Even more remarkable, researchers found that left-side sleepers experienced measurably better glymphatic brain clearance, the brain's own overnight detox system that flushes out amyloid plaques linked to Alzheimer's. If you are not sleeping on your left side right now, this one change alone could begin protecting your memory tonight. The second best position is right-side sleeping with a body pillow for support. While not as cardiovascularly superior as the left, a 2021 study in Sleep Medicine Reviews found that right-side sleeping with proper spinal alignment reduces morning stiffness by nearly 38% in adults over 60, because it maintains the natural lumbar curve and decreases joint compression. Importantly, this position also reduces nocturia, that frustrating habit of waking up 2 or 3 times a night to urinate, because it reduces pressure on the bladder and kidney pathways. Men and women over 55 who adopted this position with a support pillow between their knees reported sleeping 4 to 5 hours uninterrupted, compared to 2 to 3 hours in other positions. Deep, unbroken sleep is when your testosterone and growth hormone actually regenerate. This is not a small deal. The third protective position is the inclined back sleeping position, elevated at a 15 to 20 degree angle using a wedge pillow or elevated bed head. The European Heart Journal published a study in 2020 showing that seniors who slept at a slight incline demonstrated significantly lower overnight blood pressure spikes, reduced sleep apnea episodes, and improved cerebral oxygen flow. This position also dramatically reduces the risk of nighttime reflux triggering vagal nerve stimulation, something that can cause dangerous heart rate drops in seniors during deep sleep. Doctors in cardiac recovery units now routinely position post-stroke patients at this exact incline during overnight recovery. If it is good enough for them after a stroke, it is worth considering before one ever happens. Now here is where I need you to sit up straight and really listen, because these next 3 positions are quietly destroying senior health worldwide, and almost nobody is talking about it. The first dangerous position is flat back sleeping without any neck support. This sounds harmless, even recommended by some older sources, but a 2023 study from the Neurology Journal found that flat supine sleeping increases tongue-base collapse during sleep, worsening obstructive sleep apnea by up to 55% in adults over 55. Untreated apnea causes repetitive oxygen drops overnight. Each oxygen drop triggers a cortisol and adrenaline surge. Over months, this silently thickens arterial walls, elevates fasting blood pressure, and has now been directly linked to an accelerated rate of memory decline, roughly equivalent to aging your brain 3 to 4 additional years per decade of poor sleep. That number should frighten you. It frightens me. The second dangerous position is stomach sleeping, and I say this with complete medical certainty. After age 50, this position is genuinely dangerous. A 2020 study in the Journal of Orthopedic Research found that prone sleeping forces the cervical spine into sustained rotation, compressing vertebral arteries that supply blood directly to the brainstem and cerebellum. In healthy young adults, the body compensates. In seniors with even mild arterial stiffness, this sustained compression contributes to vertebro-basilar insufficiency, reduced blood flow to the back of the brain, which is a recognized precursor to posterior circulation stroke. Furthermore, stomach sleeping causes diaphragm compression that reduces overnight oxygen saturation, increases morning cortisol, and contributes to that exhausted, stiff neck feeling so many seniors assume is just aging. It is not just aging. It is a fixable problem. The third and perhaps most underestimated dangerous position is the fetal position pulled too tight. Knees curled hard to the chest, spine rounded severely. While mild side curling is fine, a 2021 European Spine Journal study found that extreme fetal curling in older adults reduces intervertebral disc height overnight, worsens lumbar nerve compression, restricts diaphragmatic breathing by 22%, and, critically, increases intra-abdominal pressure on the bladder, making nocturia significantly worse. Seniors in this position woke to urinate an average of 3.1 times per night versus 1.4 times for those in supported side-lying positions. Every time you wake up, your heart rate spikes, your blood pressure rises sharply, and your brain loses a full cycle of deep restorative sleep. Over weeks, this creates a compounding sleep debt that impairs immune function, hormonal balance, and cardiovascular resilience in ways most people never connect back to how they slept. Now, I promised you 3 seeds with real study-approved evidence, and I never break a promise. The first is flaxseed. A 2019 meta-analysis in Hypertension Journal found that daily flaxseed consumption lowered systolic blood pressure by an average of 10 millimoles in adults over 50, comparable to some prescription medications, due to its omega-3 ALA content, reducing arterial inflammation overnight. The second is pumpkin seed. Rich in magnesium and zinc, a 2021 study in Nutrients Journal found that pumpkin seed extract improved sleep quality scores by 31% and reduced nighttime leg cramping, a common cause of interrupted sleep in seniors, by significantly relaxing smooth muscle tissue in vascular walls. The third is sesame seed. A 2020 study in the Journal of Medicinal Food found that sesamin, the active lignin in sesame, reduced oxidative stress markers and improved endothelial function, the inner lining of blood vessels, in adults aged 55 and older, directly supporting healthier blood pressure during the overnight hours when stroke risk naturally peaks. Here is what I want you to carry with you from tonight. Your sleeping position is not a passive choice. It is an active health decision that is either working for your heart and brain or quietly working against them every single night. You have the power to change this starting tonight. Adjust your position, add a wedge pillow, place a support pillow between your knees. These are small, free, immediate changes with decades of medical research behind them. I am not your doctor on a screen. I am talking to you like a brother who has sat with too many patients who wished someone had told them sooner. Now I need one more thing from you before you go. If you want to see my next video on chair exercises specifically designed for seniors to maximize blood flow, restore testosterone levels naturally after 50, enjoy a healthy heart, and reclaim your intimate life, type chair exercise in the comments right now. That one word tells me you are ready, and I will make sure that video finds you. Your body is not done, not even close. See you in the next one.